Speak too fast. So if I'm going too fast, just give me the pump the brakes, Blazik. I've been told it's because I'm a Yankee. But, I oftentimes will joke that, I think most Yankees who come here and stay, there's a special name for us, which I won't share with everybody. But, a lot of us got here as fast as we could. So we'll be talking about managing your Parkinson's medicines, and I really thank you for that very warm welcome. So one of my passions certainly is education. I feel like there is, a lot of times you get a diagnosis kind of dropped in your lap in the 20 minutes that you get with a physician. You may get a couple of prescriptions. Hey, go pick these up at the CVS. You get to the CVS, it might be a Monday, day before a holiday, and the pharmacist is just harried. Their hair is falling out. You can see their hair falling out. They are so stressed out. And then you get home with a bag of medicines and a diagnosis that you have no idea what to do with. And so I feel like one of my roles, one of my passions is really providing medication education to individuals that come to me really confused or, really maybe got half the story from their doctor or half the story from their pharmacist. But I, recognizing that the more knowledge we have about our medicines, the more likely we are to be smart and safe with our medicines. And, one of my focuses in geriatrics, so not everybody with Parkinson's has, is of older age. But I feel like the older we get, the more medicines that we kind of get tagged onto our regimens. And so with that comes a lot of drug interactions. It comes with a lot more confusion and a lot more questions. And again, go into the CVS or the Walgreens or the Tom Thumb, you may have a pharmacist who is like, if you can come back in 2 hours, I'll have a chance to talk to you. But when you get there, they may not be, because a lot of people take a lot of medicines. So I'm going to talk a little bit today about being safe and smart with your medicines. We're going to take a couple of quick little pauses if there's just a burning question that you're like, if I don't get this out of my mouth, I'm going to forget it. Because, of course, they put the Q&A all the way at the end of 90 minutes. But we'll be talking a little bit today. And you can tell I'm an academic because I call you learners, right? So you're here to learn. Certainly. So everybody here, I'm hoping that you'll walk away with at least one little nugget. I always talk to my students about okay, what do you want your audience to walk away with? And there are 3 big kind of nuggets I'd like for you to take away. So one is describe how to use your prescription medicines for Parkinson's safety and effectively. And when I was trying to figure out what exactly am I going to talk about, because I could talk for 90 minutes about the medicines alone. And so what I was trying to do is trying to figure out, okay, what are the questions that I hear most often? And those are the ones that I'm going to try to address today. Certainly, if you have other questions, I'm happy to answer those. But also, we'll be talking about herbals and supplements in Parkinson's. And again, I kind of picked my top 3 here because, again, this could be another 90 minutes. And I'm sure that there's going to be somebody in the audience who's going to say, well, what about, I say Zippy Zap. Zippy Zap herbal. What about Zippy Zap? I heard about Zippy Zap. Somebody told me about it. I read it on a blog. And I'm going to tell you that I'm going to sit up here and go, I have no idea. Because Zippy Zap is so new and maybe 1 or 2 people are really bragging about it. But I always promise that if you email me, I will get back to you about Zippy Zap herbal or whatever it is that I maybe didn't go over. And then recognize if a medicine side effect is causing problems for the person who is affected with Parkinson's. And so I always like to go over the, I recently had I worked with an individual who has Parkinson's, and of course, they were having trouble with their bowels. And of course, it's like, hey, let's talk about your constipation. And you could tell that she just did not want to talk about constipation. But I I'm a pharmacist, and I'm not gonna lie, I kind of love talking about constipation. So this is, it's my bread and butter. If I didn't like talking about constipation, I shouldn't be here, right? So we're going to talk a little bit about how some of the medicines that you may be taking that have been prescribed or things that you're buying over the counter may actually impact some of the things that you're experiencing with your Parkinson's. And I'm not advancing now. Now I am. Okay. So I have no conflicts of interest. This basically means nobody's paying me to hawk a product. I'm not up here to talk to you about Zippy Zap Herbal today. I'm not going to start moving my hands like a used car salesman. Like, let me tell you all about Zippy Zap. My apologies if you are a used car salesman. And so what I want to start with today is being safe and essentially getting what you need from your medicines. There we go. Okay. So how many of you in this room have been told, well, just play with it. Just fiddle with it? Anybody? Like, you're like, well, I'm having this particular symptom. And your doctor's like, well, here, we'll give this a shot. And maybe if that doesn't work, give this a shot. And just kind of fiddle with it. And I hear this over and over from folks. And really, I feel like what is kind of underlying that particular sort of issue that they're experiencing is that they kind of feel like a guinea pig. There's a lot of fear. There's a lot of frustration. I feel like with a lot of disease states that physicians are interacting with, like high blood pressure, high cholesterol. You give one medicine and you see the blood pressure go down. And that's going to happen in 90% of the people that you give that blood pressure medicine or that you give that cholesterol medicine. Parkinson's is so different. I'm sure you could all talk about the things that worked for you. What works for one person was the worst possible thing for somebody else. What's working for you now just didn't work. Or what you maybe had a really bad side effect to, somebody else is like, thank you, Jesus, for this drug. And so there's a lot of trial and error. And one of the individuals that I've worked with has basically, every time I talk to her, she's like, you've seen one person with Parkinson's, you've seen one person with Parkinson's. And I will tell you that that's not just frustrating for you, that's also frustrating for your physician. That, well, crying out loud, if I give lisinopril for blood pressure, I know your blood pressure is going to go down. But as soon as I give you Cinnamate, you come back in and you tell me that you had hallucinations. And so they're not comfortable with these medicines. I mean, your physician is comfortable with the medicine. It's not necessarily going to do what they feel like it should do. And it might work in one person and it might not work in 5 others. So Parkinson's is a little bit of it's one of those diseases where there's a lot of trial and error, and what works for one person may not work for another. And I tell you all of this, and you're probably sitting there and you're like, well, that doesn't make me feel better. Thanks. You just told me that I've got a condition that is kind of frustrating to my physician. Well, it's also frustrating for you, right? You definitely can feel like a guinea pig when people are saying, well, just fiddle with it, or just mess with it, or maybe try dosing it a little bit later, or maybe don't eat as much protein in that meal. And what I feel like when people are talking to me about, just fiddle with it, what is inherent in that statement is that they're afraid they're going to mess up, especially if they are giving the medicines to someone that they love or somebody that they are maybe employed to care for. They're worried that they're going to hurt themselves, their spouse, their mom, their dad. Some of them are afraid that if they do it wrong, the doc's going to be mad. And I can tell you right now, who cares? Bless their pointed heads. Who cares? We love our doctors for sure. But if they're going to be mad, like, what are you getting mad about? Be mad about the guy that cuts you off in traffic, not about whether I messed with my Parkinson's meds. So what I wanted to talk a little bit about was sort of the good rules of thumb for this particular, when somebody says, oh, just fiddle with it. One of the things that I always tell folks is make one change at a time, whether that's adding a medicine, increasing a medicine, decreasing a medicine, discontinuing a medicine, or stopping a medicine. Always make one change at a time, because if you start doing too many things too fast, you have no idea what worked and what didn't, right? If you stop 2 medicines and your side effect goes away, well, which one of those medicines was it that was causing that side effect, right? Making this one change at a time is a really, really, this is one of my strongest recommendations. Only do one thing at a time. And I actually make this recommendation regardless of the condition or disease or medicine or intervention that is being done, whether it's Parkinson's or depression or high blood pressure or trying to figure out if that over-the-counter product caused your constipation. I absolutely, I should probably get a t-shirt made that says this, one thing at a time. One of the other things that, I feel like, especially nowadays, it's real hard to be patient. I've got a 9, a 6, and a 1-year-old at home, and so I've got sort of the varying degrees of the learned condition that is patience. I'm 38 years old. I'm still working on this, right? I think all of us are, we all want something right now. And especially when something hurts or is bothersome, we absolutely want relief right now. But what I can tell you is that when you're making that one change at a time, you want to make sure that you're giving that change an opportunity to work. And some of these medicines, it may take a week or 2. And I'm not saying Parkinson's medicines necessarily, but there are some medicines, like for constipation, may take a couple of days to really, make sure see if they're working. So the medicines for Parkinson's, you're typically going to know pretty quickly, within the next day or 2, sometimes within the next hour or 2. But you want to make sure that you're giving it time. So if you decide, you know what, I'm going to take my Cinemet at 6 o'clock instead of 4:30. Give it a couple of days and see if that really truly is what happens, or if that's really going to give you what it is that you're seeking. Again, medicines for constipation. Some of these medicines will work really quickly. We've got a couple that I lovingly call like the colon cannon or liquid dynamite. These are things that I tell folks, don't go anywhere. Be real close to the bathroom. This is not the day to go to the fair. This is the day to stay close. There are other medicines like Miralax, Docusate. These take a while to really kind of figure out whether or not they're going to work. They can take 1 or 2 days, and you have to take them on a scheduled basis. So there are certain medicines, and we'll talk a little bit about constipation here in a little bit as well, but if you have a medicine that's going to take 1 or 2 days, if you take that day 1 and then the next day you're like, well, it just didn't work. Well, you didn't give it time to work, so you got to make sure you're working with the medicine. Medicines for depression or medicines for mood can take anywhere from 6 to 12 weeks to really start feeling better and to really be able to say, you know what, this is just not working. You're not going to pop your Paxil, or you're not going to take your Cymbalta and the next day feel like, man, I'm going to take on the world today. Hopefully it'll start to give you a little bit more energy. Hopefully you'll start to feel better within a week or 2. But we really like to give, especially in, the older we get, the slower some of these things take, or the longer these things take. And so 6 to 12 weeks can actually, a lot of times we'll push it 10 to 12 weeks before we'll say, you know what, this is just not working. So you got to give it time. Medicines for hallucinations and delusions, hopefully, I pray that these work that day for you. But you really want to give these probably about a week to figure out whether or not these are going to be impactful for those hallucinations. Sometimes they can act fairly quickly. Other times you just want to make sure that you're waiting on it. And then medicines for sleep, you're going to know within the first couple of days whether this medicine is going to work for you. So again, you can see how, depending on what exactly it is that you're taking the medicines for, it may be today, It may be 3 months from now. And so you want to make sure that you're asking this particular question is, okay, at what point are we going to say, this just didn't work? Is it tomorrow? When do you want to hear from me? And that should be a question you're asking your doctor. When do you want to hear from me? And if they're like, well, I'll see you in 6 months. There is no medicine that's out there. Well, there are a couple, but they're for prostate. If you want to know what they are, I'll talk to you later. But there are very, very few medicines where we're going to wait 6 months. And unfortunately, what that means a lot of times is that in between the time that you're going to see the doctor next or communicate with the doctor next is you're going to be fiddling with it, right? Because if you have a medicine and it doesn't work, what are you going to do? You going to wait 6 months? Gosh, I hope not. So figure out, ask the doctor, when do you want to know whether this is working or not? Tomorrow, next week, 3 months? And a lot of physicians are now emailing and communicating in that way. So if you're comfortable with that communication, it can be a lot, and they can actually bill for that now. So they can bill Medicare so they're not as grumpy about giving you their email address. Used to be when Medicare wasn't paying for it, they could spend 2 or 3 hours a night on just email and following up with labs and questions and those types of things. But now Medicare lets them bill, and so they're a little less crabby about it. They weren't all crabby, but some of them were. Excuse me. What you also want to do is pay close attention to how you feel. How does this intervention, whatever it is, how does this pill, this injection, this patch, this cream, this suppository, this liquid, how does it make you feel? Pay attention to that. Write it down. You want to know, is it working? And if you have no idea what working feels like, most of the time, if you're constipated, what does working feel like? We don't have to get into that. But you know what if you take a medicine for constipation, you know what working means, right? But if you've got a brand new medicine for Parkinson's, what is this going to do for me? Is this going to give me more on time? Am I going to feel better? Am I going to wake up feeling better? So you want to ask those questions. How do I know that this is working? Do you feel worse? Definitely asking, or, basically documenting, do I feel worse when I'm on this medicine? A good question here is, if you feel worse, is this going to be the rest of my life? Because you may actually decide that, you know what, I'm just not going to be on this medicine. But there's some medicines where if you feel worse for a couple of days, sometimes those side effects go away. So you want to make sure you're asking those questions. Okay, what side effects can I expect? Because you'll go to the pharmacy and you'll get the laundry list, you'll get the paperwork. And, if you decide to go through that, it's great if you've got insomnia, take a read. Keep those at your bedside. If you're like, I can't get to sleep, open those up, start leafing through them. Because every single side effect that was in any clinical trial is included in that documentation. But as a pharmacist, I'm going to be able to tell you the top 2 or 3 things that you are going to be that you can probably experience with that drug. I'm not going to sit, if you say, well, what side effects can I expect? I'm not going to say, okay, sit down, we'll be here for the next 5 minutes. Let me read you through this. I can tell you the top 2 or 3 things. So you want to make sure that you are asking about, what side effects can I expect to have? And, a lot of times you go to the pharmacy and the technician kind of breezes through do you have any questions for the pharmacist? How many of you actually say yes? Okay, we got one guy. Okay, all right, we got a couple. All right, well, a smattering of people who actually utilize their pharmacist. I will tell you that the pharmacist who is harried and their hair is falling out, they got 30 seconds to talk to you. You've got 30 seconds to talk to them. Guess what? They're gonna hit those high points. They're gonna hit that top 2 or 3 things that you should know when you start that medicine, how long they're gonna last. And monitor this over time, and I always recommend that you keep a log. That when I took this medicine, I had diarrhea for 3 days. It went away on day 4, and then I got constipated or, whatever. And keep a log of that. Because you may be that 1 in a million person that has the 59th adverse effect that's on side effect that's on that paperwork from Walgreens. So you want to make sure that you're monitoring this over time, because you don't, I don't want to say that you're special because you experience these, but a lot of times you may be that 1 in a million person. So there may be something very special about you, and it's just that, hey, by the way, you got a hangnail with that, you got a lot of hangnails with that brand new medicine. And you kind of won the side effect lottery on that one. So you want to make sure that you're writing that stuff down. You want to know whether or not there are certain things that have occurred that are reasons for you to actually stop or decrease the medicine. So you want to make sure that if you need to stop or decrease a medicine, that you do it in the right way. Because there are some medicines, there are some medicines that you can just stop and you're okay. Medicines for Parkinson's are a little bit tricky that way. A lot of times we like to kind of what we call taper you off. So we slowly over time take you off of those medicines. And so that's why I say be careful. Make sure that you're talking to people, talking to your pharmacist, talking to your physician about, okay, it's time to stop this medicine. How do I do that? Because sometimes it's not as easy as just, I'm just not going to take this today. Sometimes we want to decrease that over time. And then again, documenting, making sure that you're keeping notes. And I know that a lot of the folks that I work with who have Parkinson's and their loved ones, they have notebooks full of notes. And so sometimes you just want to make sure that, like, okay, I'm taking very, very, very detailed notes. Sometimes maybe over the last week, take a highlighter and just highlight what were the high points. I gave you this medicine and nothing happened. I gave you this medicine and it worked. That was great. I gave you this medicine and you took off all your clothes and went running down the street. Probably need to highlight that one. Probably need to call the physician about that one. Actually, my favorite side effect that I ever, I'm a pharmacist, so of course I have a favorite side effect. I could write a book. But I had an individual who was on the new Pro patch. And actually, he was in the clinical trials of the new Pro patch. And I remember talking with him, and I was like, oh, how you feeling? This is so exciting. It was just this, this was 10 years ago when new Pro was still in clinical trials. And he said, I'm feeling great. I'm like, you having any side effects? And he's like, no, I'm great. About 10 minutes later into this conversation, he's like, yeah, there was that one time I was driving down 75, and I woke up 2 exits later. And I was like, you fell asleep while driving and woke up 2 exits later. He wasn't having any side effects. So watch out on 75. Don't assume anybody's paying attention. Cell phones, Parkinson's meds, everybody's got their thing. I think another thing that I hear all the time, and certainly I am not a dietitian. I'm not going to sit here and say that, well, let me teach you all about good nutrition, because I'm sure that either you've had a dietitian or you're going to have a dietitian, and they're going to walk you through all of this. But because this is a drug interaction, a drug-food interaction, and I hear about it a lot, I wanted to make sure that I went over it. So I think the common misconception that I hear is that you can't have any protein. So if you're on levodopa, you can't have any protein. And I promise you that is not the case. Now, there are going to be people in here that will be like, I can't have any protein. And, my levodopa doesn't work when I have protein. Okay, you have won the lottery when it comes to being that special person that cannot have any protein. But you can eat protein. I promise you. Protein misses you if you've gotten rid of it. And the medicine at issue is levodopa. If you are not on levodopa or not on levodopa yet, there is no protein issue. There is no protein issue. Because levodopa and the breakdown products of protein kind of look the same. And if your gut is kind of looking at, hey, there's this protein, and then there's this levodopa, guess which one your gut's going to pull up? It's going to pull up the one that looks like something you just ate. And so protein wins. And this can result in levodopa maybe not working, maybe it takes a little longer, maybe you're not getting as much of effect with the levodopa, and that's because protein wins. But good rules of thumb for protein: if you're not on levodopa, don't worry about it. Have a milkshake. Go to the Big Texan. Every time we go to Amarillo, which is where the main campus of our pharmacy school is, drive past the Big Texan and that 72-ounce steak. And every single time I drive past that, I always think of the individuals I work with Parkinson's, and I'm like, man, protein bolus. So, but if you're not on levodopa, don't worry about it yet. You'll have to worry about it eventually, but don't worry about it yet. And don't give up all protein. You need protein. The rules of thumb that I mention are that just be consistent with regard to what you're eating, the time of day that you're eating it. There are some individuals that I've worked with that say, I can have eggs and bacon in the morning, but if I eat any protein at night, I am toast. And then I have individuals that say the opposite. If I eat eggs and bacon in the morning, I am slow for the rest of the day. But give me a steak at night and I'm fine. And doses can be increased or decreased to account for protein, but this has to be done very carefully and with your doctor. So your doctor will say, well, just fiddle with it. See what the protein, so, it's the catch-22. Like, they're going to tell you to fiddle with it. Fiddle with your protein. When are you going to eat it? What are you going to eat? But pay attention to what happens when you eat protein and when. And sometimes, again, you got to get that notebook out. Had bacon and eggs. Had a great day. I mean, you start with bacon and eggs. It's going to be a great day. And again, I am not on the take for the bacon and eggs lobby. So you can be assured that this is just my personal opinion. But again, are there certain foods? If you have a milkshake, if you have your Big Texan steak, are there certain times of day? So just making sure that you are aware and maybe documenting what's going on with the protein. Are there certain things that actually, are more troublesome or more bothersome? And the next one, oops, I missed a dose. How many of you have never missed a dose? I always like to ask that question, because if I say, how many of you have missed a dose, everybody's hands go up. Or everybody's just like, oh, no, I've never missed a dose. But these are not easy regimens. And a lot of times, folks who have Parkinson's have other things that they're taking medicines for. They may have high blood pressure. They may have diabetes, high cholesterol. There are a lot of other things that people take medicines for in addition to Parkinson's. And Parkinson's alone makes this difficult. So when you miss a dose, give yourself some grace. We are human. It's going to happen. And I didn't see anybody raise their hand when I said, has anybody never missed a dose? She's hiding. Do you see this? She's hiding. She doesn't want anybody to be, Oh okay, all right. So, as one lives longer with Parkinson's, these regimens can get much more difficult, more pill heavy. So again, like, when you're taking Cinemet every 3 hours, how are you managing that? And there's a lot to remember. And so good rules of thumb for missed doses is do not double up. I will many times just say, just don't double up. Well, but my next dose is coming. If your next dose is coming, it's coming. Take it a little bit early. Take that one pill or whatever that next dose is. Feel free to back that up, back the dose up, especially for those individuals that have every 3 hour Cinemet. If your next dose is due and you forgot the last one and you feel, because that's the thing with Parkinson's, is most of the time if you don't take the medicine, if you forget the medicine, you feel it. So don't double up. It's just a good rule of thumb. Very few medicines, and actually none that I can think of off the top of my head where I would say, yeah, go ahead and double up on that. I will say the nice thing about Parkinson's meds, I know that you're probably like, Blazik, the nice thing about Parkinson's meds? All right, well, again, it is that you know when you've missed a medicine. And so you can, especially if, as some individuals start having problems with their memory, that, a lot of times those individuals can say, you know what, I know that I missed a dose. So take it when you remember it, but do not double up. For missed patches, if anybody is on a patch, I know there are a couple of medicines like Nupro for Parkinson's. Some people may be on the Exelon patch for memory. And so place it on when you remember it, but make sure to take off the last patch. In pharmacy school, they always tell us the medication misadventures. They're the horror stories. They're the people who don't, I remember one of my professors saying, always make sure that you put on the instructions, unwrap and insert the suppository. So that's one of them. This is another where you need to say, take off the last patch and apply the next patch once a day. Because the medication misadventure that we heard here was that the individual came in, they couldn't stand, they had a lot of very low blood pressure, couldn't stand up, they were wheeled into the emergency room, and when they disrobed them, they had patches everywhere. They had forgotten to take off the pain patch, and there are folks that love patches. They love them. And so they've got their Exelon patch and their Nupro patch and their estrogen patch and their nitroglycerin patch. And let's see and their pain patch. And so, if you start losing real estate at some point, but, you have to make sure that you're taking it off and then applying the next one and get back to normal dosing with the next one. And again, make sure that previous patch is removed. So what should you actually tell the doctor? In a word, everything. And there's no physician has told me to say this to you. But really, it pays to be honest. So make sure that you let the physician know when you go in. Make sure to let them know what you're taking, how you're actually taking it. If it's something that they prescribed that you had a bad side effect to, or if it's something that they didn't prescribe that you're taking, or you took a half a dose, or now you're taking it 3 times a day instead of twice a day, be honest, because a lot of times what can happen is the physician will say, okay, well, this is everything that I've got you on, and this is how I have you taking it. And now that you're having this effect, I'm going to add a medicine to help with that. Whereas you may have just stopped taking the medicine that typically helped with that, and now they think that you're taking the one that you're not taking, and now they've given you another medicine. That's what we call the prescribing cascade in the pharmacy business, and it can result in a big medication regimen real quick. Making sure that you're letting them know about herbals and over-the-counters, and then letting them know about side effects that you experienced, what you experienced, when you experienced. Get out your notebook and let them know. Keeping a list, making sure that everything that you're taking and how you're taking it is that you have this. Keep this with you. Give this to everybody that you can possibly get it in the hands of. Hopefully some of you brought them today, and you can just everybody look at your neighbor and say, here's my list. I might need you to have this. But making sure that you've got your over-the-counters, your herbal supplements, and why you're taking them. A lot of times I'll get these lists. Somebody will come up and say, hey, I've got, can you take a look at my list of medicines and just make sure everything's okay? And then when I say, well, what are you taking this for? They're like, oh, I don't remember. Oh, well, so-and-so told me to take that. Somebody said it was good for insert symptom here. And so you got to be real cautious with that. So if you don't remember why you took it or why you're taking it, might be time to think about getting rid of it. And obviously, if it's a prescription medicine, making sure that you're talking to your physician about that. And I always recommend to actually keep this in Word, like a electronic format, because things change all the time. As you're fiddling with your regimen, what are you taking now? And making sure that you've updated that list. One of the other things that I have actually noticed with a lot of individuals that I work with is the things that are medicines in their mind. So when I ask, what medicines are you taking? They've got a list. They pull out their list. Okay, well, are you taking any patches? Because I don't notice any patches. Oh yeah, I take the Nupro patch. Well, why isn't that on your list? Or I have a cream that I put on my arms every night. Well, why isn't that on your list? Or an eye drop or an ear drop. If you put it into or on your body and it is not food or drink, it's probably a medicine, and it probably needs to be on that list because it can have drug interactions, it can have side effects, it can have things that we as your healthcare team need to know. So, being a Yankee, I'm kind of missing the fall foliage, and so I decided I was going to give us a break. But because this ticker says 27 minutes, is that right? I thought I had 90. Oh, okay. Then we're going to skip over the Q&A. Everybody take a deep breath. You got 27 minutes, 16 seconds worth of Blazic. But we are proud of our covered bridges in Pennsylvania. Yes, Q&A is after the 27 minutes, so we're just going to keep on going. So herbals and vitamins and supplements, oh my. Herbals and vitamins and supplements, oh my. Like this is, as I was putting this together, I'm like, that's exactly what I think of because they are just as scary to me a lot of times as lions and tigers and bears, oh my. So let's talk a little bit about what herbals are and what they aren't. So all herbal products and supplements are safe because they're natural. True or false? False. Oh, so smart. All herbal products, supplements must undergo rigorous clinical trials to determine they are effective. False. All herbal products and supplements are free of drug interactions. All herbal products and supplements are of the same type must, by law, have the same active ingredient. Okay, well, we're just going to skip over this entire section because you don't need me. But herbals and supplements can be problematic for sure. These are not regulated by the government other than if 4 or 5 people die, then the FDA kind of steps in. But until 4 or 5 people die, we're kind of winging it. So they monitor safety, and again, that safety data that comes to the FDA is actually voluntary on the part of the supplement. So as you can imagine, the supplement makers are not really in a position to really feel like altruistic for volunteering this information. So the FDA is monitoring safety and product information, and they only step in when there's an issue. The labels must be truthful and not misleading, so it cannot say cures Parkinson's disease, but it can say for brain health. But for brain health, like heaven only knows how they figured that out. And the FDA recently, I get these little email alerts in my email every day, but they're starting to find some really scary things in some over-the-counter supplements, things that they buy at GNC or that people are buying off the internet. Things like Viagra, some stimulants that people will use for weight loss are ending up in herbal products. So there's some spooky stuff out there. So they can cause considerable harm. They can cause side effects, and especially because when somebody hits the ER, they're asking about medicines. And again, if you don't think about herbals and product and supplements and those types of things as medicines, you're not telling that to the physician, right? You're not telling that to the ER staff. So they can cause considerable harm for sure. They can cause drug interactions, and they can cause disease state interactions, which basically means that if you've got Parkinson's, herbal supplement Zippy Zap could potentially make the Parkinson's worse. They can be very pricey. Certainly, I always say it's not just the supplement that you're paying for, it's the potential emergency room visit that you might be paying for. And so you got to be careful. And if the claims seem too good to be true, they probably are. So the big three that I see, we're going to talk a little bit about coenzyme Q10. This is the one that I actually put in my can't hurt, might help category. There's some other names that it's known by. It's a natural antioxidant. There's some some evidence to support that it might be helpful for Parkinson's, might be helpful. And then there's other evidence that says, it doesn't really matter, doesn't really work. And so the dose that has been studied that has been shown to be effective is 1,200 milligrams a day. And this is actually a pretty pricey supplement. I've had some people that say, well, I buy mine at the Costco, and it doesn't seem to be that bad. But it's the 1,200 milligram dose. It's when you get to that sometimes it can be pretty pricey, especially, and it can be, you can basically fill up on pills and not have to worry about bacon and eggs because you've taken 12 100 milligram tablets, and now you're not hungry because your tummy is full of pills. And that's at 600 milligrams twice a day. And what it showed is that it slowed functional decline, but it did not promise any kind of neuroprotection. It didn't hard halt the disease state where it was. Again, there are other studies that have shown that even this dose didn't have any effect. So it's kind of one of those, well, maybe it works, maybe it doesn't. But the side effects, it is traditionally well tolerated, but I always like to tell people if you have low blood pressure already, which many people with Parkinson's do, or you have low blood sugar, or you have diabetes, I always say to just be careful with this. Maybe have a little bit more monitoring of your blood sugar or your blood pressure when you're taking this. Drug interactions, this is again sort of a drug disease type of interaction where you just want to be careful, monitoring a little bit closer. And it does play nice in the sandbox with other Parkinson's meds. And like I said, it can be a little pricey. I put this in the category of can't hurt, might help. So it's well tolerated, it's got very few drug interactions, unless you've got really low blood pressure or you have diabetes, you gotta be careful with that. It's got the best evidence of any supplement out there with regard to some of the functional issues that people with Parkinson's have. I have not saying much, but it's what we got. It's the best that we've got. And always talk with your doctor about starting any of these things that we're going to go over. Coconut oil is another one. I remember about 6 years ago, I had somebody raise their hand and say, well, what do you think about coconut oil? And I was like, I wish I could tell you. I wish I could tell you what I think about coconut oil. And it's because, again, like there's so much voodoo out there that people are like, oh, this is great. This is working. This is what I take. And so I cannot keep up with everything that everybody is taking and what everybody is saying about them. And that's why I say, if you have a question about a certain herbal supplement and I kind of give you I have no idea, I've got my email on the slides, so please email me and I'll get back to you. This is believed to provide the brain with an alternative source of energy. So rather than glucose, it gives our brain ketones, which is a breakdown product of coconut oil. There's been a lot of interest in this in those individuals who have Alzheimer's. But folks with Parkinson's are interested in this. My one big caveat here is this is a saturated fat. Most people will say it's a healthy fat, for sure. But it contains more saturated fat than butter or lard. And really should be used in moderation because of what we know about saturated fat and the cardiovascular or the heart health. That this is not a heart healthy fat. It's a healthier fat than lard, but it's still a saturated fat you got to be careful with. And again, people are using it to prevent or treat memory problems. So the scientific evidence doesn't support that it works, but while you wait on this, there are some online claims from individuals with Parkinson's that this is miraculous with an exclamation point. Miraculous. Coconut oil, miraculous. It got rid of my brain fog. And that's, I mean, that is a legitimate, that is something that folks that I've worked with Parkinson's absolutely talk about. They're just like, I just feel kind of like I'm going through life with a fog, in a fog. My tremor went away, so maybe. The question is, of course, what are the side effects? What are the drug interactions? What is the dose? Who knows what the miraculous person is using? Is this somebody that is taking, 1 heaping teaspoon of coconut oil and just, and if you look at coconut oil at room temperature, typically it's either liquidy, depending on what your room temperature is. It can be a little liquidy. It can actually look like Crisco. It smells great, but I think it tastes like Crisco too, so you need to mix it in something. I don't know many people who can stomach a big heaping spoonful of coconut oil. But again, the question is, okay, if it does work, how much do you take? And are those calories and some of the heart health risks, are they worth it? And for some folks, it's like, you know what? If it clears up my brain fog and I can talk to people and not feel like an idiot, maybe it is. And again, this is definitely one of those. I can't put it in my can't hurt, might help, but I definitely put it in the let's keep an eye on this one. So side effects, oily bowel movements and accidents. Sign me up for that one, right? I think there were some potato chips a couple of years ago that were fried in a certain fat that actually had that side effect on the bag. Side effects from food, may cause oily stools. There is no Dorito on this planet that is worth that. Increased cholesterol, weight gain, and obviously for some individuals with Parkinson's, weight loss can actually be a problem, and so maybe a little weight gain isn't a bad thing. Some drug interactions, there's nothing that we know of currently that coconut oil interacts with, but the more people use this, the more information we're going to know. So this is relatively new with regard to information that we're receiving. And it does play nice with other Parkinson's medicines so far is what we know. And I put a little asterisk on all of this. It's like what we know now. This could change tomorrow. But again, using this with caution, it has more saturated fat than butter or lard, and you have to worry about that increased risk of heart issues. I will tell you that the cardiovascular outcomes or the heart attacks and strokes, they kind of spook me. But I think everybody's got to make that decision for themselves because some people have a long line of heart attacks that impacted their family at age 50. May not be the supplement for you. You may come from a long line of individuals who lived till they were 90. Maybe you want to give it a shot. So it's gonna depend. It's still too many questions for me to comfortably recommend, and I just say that we went over this. It's out there. There are people with Parkinson's who are using this. It's on blogs. It's on, Michael J. Fox. There's some stuff on Michael J. Fox, a smattering here and there, but really just being careful with this one. This is another one that, as I was kind of peering through all the blogs, cowhage. Looks like black beans. Sounds like, yeah. Some other names that you can is mucuna pruriens. The seeds are known to contain basically low doses of levodopa. So if you're already on levodopa, probably want to avoid this one. So is there some sense that it works? Maybe. Again, because it basically behaves like levodopa or contains levodopa, stands to reason it's going to work. But if you're already on levodopa, probably not the best thing to try. And there's nothing really standardized. Remember the herbal quiz, that there is nothing that says this product of cowhage or this product of cowhage, this product of cowhage, or this product of cowhage. There's nothing to say that it's going to be standardized between them. And so you can try one and it doesn't work. You can try another and it does work. You can try another and it lands you in the hospital. So you've got to be real careful about this. Some side effects that we know about, again, relatively new, but these are the things that we know about. You can see low blood sugars, you can see mild stomach upset, but my friends with Parkinson's, this is upset stomach is, you are very familiar with upset stomach. And there is a case report of psychosis. So somebody who was experiencing hallucinations, delusions with this particular medicine, but it may have very well been somebody who was already on levodopa. Some drug interactions include anesthesia. So if you got any kind of, basically the same drug interactions we see with levodopa that you want to be careful with, and then diabetes medicines. I would recommend against it at this point. Again, because we know what's in levodopa prescription products, because the FDA regulates those, versus what is in this particular herbal product, I would definitely say if you're looking for what levodopa can do for you, go with levodopa as opposed to this. Pennsylvania. I am from Williamsport, which is, this is my country right here. Yes, and I went to school in Pittsburgh. Did you say Bethel Park? Is that where you're from? What's that? Mount Lebanon. Mount Lebanon, okay. I know you and I had talked about Pittsburgh before. But, you know, when you live in Pennsylvania, you're like, this is so boring, there's nothing to do. And now I look at pictures and I'm like, man, that's some pretty country. I grew up like right there at the bottom of that. I mean, this isn't my house or anything, but like, I mean, right at the bottom of one of those ridges, that's where my house was. But, okay. So, last section that we're going to talk about is, could what you were experiencing be your medicine? And, you know, when I think about the folks who are impacted by Parkinson's, you know, I feel like the general population, when they think Parkinson's, what do they think? They think tremor every single time. And yet a third of people who have Parkinson's don't have tremor. So my goodness, how misunderstood is this disease when some of the cardinal symptoms of the disease aren't even present in a third of the people who are impacted by it? So it makes sense that people are not going to know that there's anything else going on with Parkinson's, including memory problems, constipation, fatigue, that brain fog that people talk about, hallucinations or delusions, depression and anxiety, insomnia. And so I always ask, or I always tell folks that if you start to experience something new, the first question you ask, and this is always what's going through my mind, is that when somebody comes up and says, I'm so nauseous, oh, I'm so constipated, I can't sleep, the first thing I think of is medication side effect. And so I encourage you that anytime something new is happening, think that it is a medication side effect until it is ruled out. And I know that's real hard because you're like, oh, I'm constipated, I'm going to go to the pharmacy. And it's so easy to treat over the counter, right? But what has changed? Has a medicine changed? Have you increased a dose? Has your diet changed? Have you stopped exercising? What is going on? Maybe maybe you got a little sick, and so you've decreased your water intake. So you want to make sure, like, could these medications, could your medicines that you're taking be making it worse, and what can I take to help? And so we'll talk a little bit about memory problems that can be experienced with folks with Parkinson's. Currently, there are some medicines that are FDA approved for Alzheimer's. The only one up here that is approved for what we call Parkinson's disease dementia, or memory problems that are related to the Parkinson's, is the Exelon patch, but you could be on any one of these. So just because a medicine has the indication doesn't mean that the other ones won't work. It's just been shown in a clinical trial, and they pursued the indication, and so now they can be the one that markets it. But some common medicines that could be causing memory problems. This first one, I know that you guys are probably like, diphenhydramine? Wait, what? My little pink pill? It is in everything. I feel like diphenhydramine is a sort of ubiquitous over-the-counter product. It's in everything. If you have trouble sleeping, you get diphenhydramine. If you've got a cough and cold, you got diphenhydramine. If you have allergies, you get diphenhydramine. But diphenhydramine can actually cause a lot of issues. It can cause people to be very fuzzy. When I was in residency training, we had an individual who his daughters thought he had Alzheimer's. What he had was a Benadryl problem. And as soon as we stopped that Benadryl, he was feeling fine. And his daughters were like, oh my God, was it really the Benadryl? And we're like, yeah, it was. So this medicine can cause memory problems. And so what you're going to see is that just about everything that we go through, diphenhydramine is probably a medicine you want to avoid as much as possible. There are actually some studies that have shown that using medicines like diphenhydramine over time, so even in younger individuals, using too much of this medicine can actually increase the risk for Alzheimer's. It's still completely, it's still kind of what we call hypothesis generating. We're still interested to know, is that really the case? But there's some pretty convincing evidence that it might be true. So what I recommend is that if you don't need to use diphenhydramine, get off of it as quickly as possible. Other things that can cause memory problems, anything that you use for bladder control, if you've got like a bladder medicine that maybe you've got bladder spasms or any of those gotta go right now type of medicines, those medicines can actually contribute to memory problems because the same mechanism that stops your bladder actually can basically prevent the chemicals in your brain from laying down new memories and retrieving memories. So it can look like Alzheimer's. And then medicines for Parkinson's. There's benztropine, there's trihexyphenidyl. These are very, very old drugs that a lot of times are used in younger people with Parkinson's. So if you are a young onset Parkinson's, a lot of times they'll use this if you've got tremor predominant Parkinson's. So very rarely do I see an individual on these, but absolutely these medicines can cause memory problems. And amantadine can sometimes cause issues with memory problems, so you want to be careful with that. Constipation, again, one of the individuals I was working with, she just did not want anything to do with talking about constipation in her bowels, and but it was her primary problem, and so we talked about it quite a bit. There are medicines that you can use to treat this. So you've got stimulant laxatives like Senokot or Bisacodyl. You've got stool softeners like Docusate or Colace, and I can tell you if you are buying brand name Colace, stop it. Please buy the generic Docusate. I actually had an individual who was just like, no, it has to be the brand name, and he was paying $15 for 30 tablets of Docusate when he could have been paying, $1.50 for the generic, and it's the same thing. There are other medicines for constipation, like enemas and lactulose, Miralax, magnesium citrate, which again we lovingly call liquid dynamite. So if you drink a bottle of mag citrate, don't go far. Lactulose is what we lovingly call the colon cannon. So these are very effective, but not things that we want to take on a regular basis. But some common medicines, there's our old friend diphenhydramine. This is kind of a big thing. With diphenhydramine, you get memory problems, you can get constipation, you can get problems with urinary retention, which is basically where your bladder doesn't quite know what to do to get rid of urine. Again, anything for bladder problems, so oxytrol patch, Detrol, the same medicines for Parkinson's. So again, the same area, or what we call the receptor. So the same receptor, the same lock and key mechanism that causes memory problems is also going to cause constipation. Supplements, common supplements can be iron and calcium, narcotic pain medicines. So if you're taking a narcotic like hydrocodone, oxycodone, morphine, tramadol, these can all be contributing to constipation. And so a lot of times we'll actually make recommendations that if you have to be on one of these, especially with the narcotic pain medicines, or if you have to be on iron or calcium, a lot of times we'll actually recommend that folks give something like Senokot a try, because it just keeps things moving, because most people are going to get constipated with those. Fatigue is a fairly common symptom that folks with Parkinson's can experience. You can actually see some of the stimulants that are used for ADHD in younger people being used to kind of combat those side effects of fatigue. Some people that I've worked with have said that these made the Parkinsons feel worse, made them feel too jittery. Because they said, well, I already feel kind of jittery and kind of like I'm moving all the time. I don't need a medicine. But those are the medicines that can sometimes be used to kind of pep people up. But common medicines that could be causing fatigue is, I always tell people, are you taking a medicine to help you get to sleep? Could basically the side effects, could the medicine still be working the next day? Especially when people are like, I just can't, I feel like I need toothpicks to keep my eyes open. If you're taking a medicine the night before, it could just be kind of still lurking around. Definitely something to talk to your doctor about if you're still feeling groggy the next day. Medicines for Parkinson's can make people feel like that if you're on one of the dopamine agonists, pramipexole, ropinirole, rotigotine, which is the patch Nupro. So if you're receiving one of these medicines, people can say, they make me feel like I'm about to fall asleep. And the others are less likely, but the dopamine agonists can be the cause of the fatigue as well. And then if you're on a beta blocker, these are things like metoprolol, atenolol, carvedilol, anything that ends in olol, that's a beta blocker. And these medicines can actually cause issues with people feeling very sluggish because it works to slow down the heart, and as the heart goes, a lot of times so goes everything else. And that's actually why they give, for people that get maybe anxious before they do a presentation, they'll actually give them propranolol because that kind of slows your heart down, like it just makes people feel very easy breezy. And then narcotic pain medicines. This is actually one of the very common side effects of these medicines. A lot of times people will get, they'll get to the point where they won't feel the sedation as much, but there are others who will just not be able to tolerate them long term. And so I've actually seen individuals who are on narcotic pain medicines who are so sleepy throughout the day that they'll actually get a medicine to kind of pep them up. And again, that's kind of that prescribing cascade that we were talking about earlier, is when a medication side effect is being treated with a medicine. But for some of these conditions, we can't necessarily stop the pain med because then the pain prevents you from getting on with your life. And so a lot of times these may be necessary. Hallucinations and delusions, and I think that when we start talking about this, people get real antsy because they don't want to talk about this. They don't want to talk about the fact that they're seeing things or believing things that are not true or not really there. Unfortunately, this is a fairly, I don't want to say fairly common, but it's common enough that I feel like it's important to talk about it. The medicines that we typically use to treat this in individuals with Parkinson's are these three antipsychotics. Every now and then you'll see Abilify or aripiprazole that are being used, but these are medicines that when those hallucinations or delusions are scary or they're a danger, that, I had an individual who I worked with when I was in training in Baltimore who, him and his wife came in for an assessment, and she sort of recounted this story about how in the middle of the night, she woke up and he was screaming at her with a gun in her face, saying, "Get out of my house. I don't know who the expletive you are, but get out of my house." And of course, she got out of the house. But it was a hallucination that needed to, it was a danger to her for these hallucinations to continue, and so we actually started one of these medicines, especially when those regimens for Parkinson's are kind of hard fought. You're like, it's been 6 months since I've felt this good, and then when you get hallucinations on top of that, sometimes it's worth keeping the Parkinson's meds because the Parkinson's meds can be the cause of this particular issue. And so again, this is one of those things where if the Parkinson's is hard fought, we want to make sure that we are helping the person with Parkinson's, but also taking care of those hallucinations and delusions. Oh my gosh, the diphenhydramine. you know, like, okay, Blazek, you're beating this horse to death. But I am, like I say, when I tell you that this particular drug in my world of the older adult who is taking medicines, this particular drug is, we just got to get rid of it. And anything for bladder problems again. And I am out of time, but I am going to keep on talking for just a couple more minutes because I've just got a couple more slides. There are a lot of medicines for depression and anxiety. I've put them all on this slide just to show you how many stinking ones there are. There are a lot of medicines for anxiety and depression. And I feel like every time we get a generic drug, we get 2 more brand name drugs. And so there's a lot of medicines out there, and it's because it's a fairly common condition. Medicines that could be causing depression or anxiety include beta blockers. Some people will say that they feel depressed on these. And then the benzodiazepines, which is a real fancy name for things like Ativan or Valium. And then anxiety, caffeine can be causing it. And then those stimulant medicines that I was talking about earlier. If you're having trouble sleeping, there's a lot of medicines out there that could be helpful, but you got to be careful. Obviously, diphenhydramine can be an issue. Benzodiazepines and some of the other hypnotic agents can be used. But, you know, I always like to be cautious with these because, especially if you've got somebody who already has maybe some disinhibited behavior, maybe likes to disrobe in the evening and kind of lounge about it as if they were Hugh Hefner. Probably not. Probably a medicine that you want to avoid because these kind of disinhibit the already disinhibited person. One of my students actually called this naked time at the nursing home that we are at. She was like, you can always tell who had their benzo because there's always some report the next morning of so-and-so was walking around with their robe open trying to get a date. There are a number of medicines that could cause insomnia, stimulants. If you're taking a diuretic close to bedtime, a lot of times we'll tell people back it up to 2, you know, maybe 2 in the afternoon as opposed to right before bedtime, and then caffeine. Really making sure that you know, if you recognize that maybe a medication is causing a side effect, identifying that problem is number 1, and then asking yourself, is a medicine causing that again? My first go-to is this a medication side effect? So the first question when somebody says, I'm having this problem, my first question is, did you start something new? Has anything changed? And really work with your doctor or pharmacist. All right, so we're just going to sum it all up. So really, I want you guys to know that you are not the only one who is struggling with managing medicines or really kind of floating along in this sea of misinformation. And so working with your doctor, working with a pharmacist, sometimes the pharmacist, getting to the pharmacy at 5 o'clock on a Monday, you're not going to get any pharmacist time. I promise you. You're going to be able to literally see their hair falling out. But make sure that you are, you know, just say, hey, is there a good time I can come in and talk to you about this? 7:30 on a Friday night? I mean, really, like, it's not the sexiest date night, but it might actually be, you know, something exciting. But document your experimentation, what's working, what doesn't, what side effects are experienced, letting us know kind of what's going on. The bigger the story, the better the story, the more details, the better we are to able to help. Be careful with herbals and supplements and vitamins. Oh my. Ask questions about effectiveness, side effects, and drug interactions. And then get a good review of all medicines you're taking from someone who knows medicines. I wonder who that might be. It doesn't have to be me, but I would say a pharmacist. I went to school for a long time to just focus on medicines. So could your current medicines be contributing to problems? And so making sure that you are working with a pharmacist or working with your physician who is able to give you the time that is necessary to really be able to take a look at everything that you're taking, recognizing there's side effects from everything that you're taking and making sure that they're not interacting. That's all the slides, and that's it. Normally I put a little questions or something like that at the end, but I will now entertain any questions that you might have.
Okay. We're going to open up the Q&A session, and if you, I am here and Pam is on the other side with a microphone, and we'll take turns, and if you will just wait until we get you the microphone to make sure that everybody can hear the question first. So we have someone.
Could you talk a little bit about different manufacturers? Jim is on the Carboleva. And they've substituted a couple of times, different manufacturers, and all of a sudden he's having insomnia. And now they're saying that Mila is not going to be making the 25-100 milligrams, and that's the one he's been on for years and works great. They substituted the other one we had, so I just wanted you to talk about that a little bit, if you would.
Sure. So the question really kind of speaks to, you know, when a medicine goes generic, it's not just one generic manufacturer that can make it. And so basically what the FDA says is that generic drug needs to be within 15% on either side of the parent drug, so that brand name normal drug. What that means, and certainly generic manufacturers are going to try to hit it right on the mark, because if you go from brand name to generic name and it doesn't work, guess what? They don't make any money. So they're gonna go for that 100%. Like, I know some people are like, well, if I were that, I'd do 85%. Less drug, more money. This is great. But it doesn't work like that. But the FDA basically says you have that window. And so when folks, especially in a disease like Parkinson's, when you have a medicine that, you know, is working well, and then you get a substitution, it's not like a blood pressure medicine. It's going to be something that he feels right away, that you see right away. And so there are ways around that. I mean, if Mylan is stopping the 25-100, and I haven't heard that, but manufacturers make decisions like that all the time. If something's not selling well, they're just not going to make it. And so if you experience something like that where you get converted to a certain generic manufacturer and it just doesn't work, it doesn't work the way that you wanted to, there are a couple of things that you can do. I was a pharmacist in retail pharmacy for just a couple of years, but we'd have folks that would come in and say, I need this particular generic. And because we were in the business of taking care of people, we would stock that particular generic. And a lot of times what we would do is we would put the patient's name on the bottle, so that when I went up to the 2 carbidopa levodopas, I'd have a big bottle of whatever CVS could get for cheap. And then I'd have the teeny tiny bottle that I would use for Sally. And so you can do that. Pharmacies should be able to do that for you. And especially if you go to your pharmacist and you're like, I heard they're stopping making this. Can you get me a big bottle of it? Pharmacists are going to bend over. A good pharmacist who cares about patients is going to bend over backwards to make sure that that is done. The other thing you could try to do is you could go back to the parent drug, the brand name drug, which is going to be a little pricier. But a lot of times, the drug that you did well on, a lot of times is going to probably reflect very closely to that brand name drug. It's just going to require that your physician write brand medically necessary in their own handwriting on the prescription. And it might cost you a little bit more, but for the most part, those are kind of the 2 strategies that I would encourage you to do. But like I said, a pharmacist who is really in the business of taking care of people is going to be able to do that for you.
I have a 10-part question and a follow-up.
10-part question and a follow-up. Okay.
No, just kidding.
All right.
I get most of my drugs through mail order, and I get a couple from the pharmacist, and I'm not really comfortable with going to the pharmacist without him knowing all the other drugs, even though if I give him a list.
Yes.
So what do you suggest for those of us who have most of it delivered to the home.
Yeah.
As far as getting them all reviewed. Because I have another chronic disease, diabetes, to go along with it. And so I know there are interactions there. And I'm not real comfortable even necessarily going to my doctors that aren't related to Parkinson's to get the answers either.
Yeah. So mail order is very, very common, and there are a lot of employers or a lot of insurance companies that will actually try to do their best to get you to go mail order. They'll say, well, we'll give you 3 months for $10 versus if you go to the Walgreens, it'll be $10 for 1 month. And so financially, it makes a lot of sense. And so a lot of times what happens is it's just the medicines that you need sort of fairly quickly, like a pain medicine or an antibiotic that you're getting at just a regular brick and mortar type pharmacy. And so the question then becomes, okay, there is nowhere on this planet that has a full medication profile of mine. So I've got antibiotics and pain meds, and then I've got all the chronic disease state meds that I'm getting on a regular basis. What do I do? And really, it comes down to keeping that list and talking to your pharmacist and getting that list in front of your pharmacist, and especially that retail pharmacist. A lot of these mail order companies actually have a room full of pharmacists who are basically sitting around waiting for you to call. They're bored, they need love too, so go on and give them a call, even if it's just to say, hey, happy Friday. But, jokes aside, giving them a call like, hey, I'm on the way to CVS to fill this prescription. Can you please take a look at everything else that you guys are filling and just let me know if this interacts? Or you can whip out that list that I was telling you about, get that list out, give it to your pharmacist, and even if they can't eyeball it and say, oh, I don't know, they have drug interaction screen tools in the pharmacy that they can just sort of pop all your medicines into just to make sure everything's okay. And there are a lot of drug interactions with antibiotics, and there are a lot of drug interactions with pain meds. And so especially if those are the medicines that you're getting at the brick and mortar pharmacy, and then you're getting everything else with the mail order, there can be some very dangerous interactions. And so I would always recommend that you either call the mail order and say, hey, I'm going to pick up my Cipro at the pharmacy. Tell me if it's going to have any interaction, or give that list to the pharmacist there. And there are actually some insurance companies, because everything is kind of adjudicated through your insurance company, so the pharmacist is billing everything through your insurance company. Sometimes the insurance company will put hard halts. So they'll basically say, we're not filling this because of this really major drug interaction. But I would never rely on an insurance company to give you pharmacy advice. Yes.
I've got a question. I've been asked to participate in a drug trial later this year, and it's a different delivery system for levodopa. Any questions I should be asking relative to that and my other drugs?
Sure. So clinical trials, the wonderful thing about living in a big city is we've got access to a lot of different clinical trials. And so for this particular drug, when you enroll in a clinical trial, you're basically going to go through a very rigorous screening process. They're going to make sure that you fit sort of the profile of the person that they want, and they're going to make sure that you don't have anything that they don't want in the trial. So if you pass out with every dose, they're probably not going to want you in the trial. But if you are, so when you go in, a lot of times they are going to give you 16 stacks of paper, then lots of things that you have to sign. They call informed consent. It basically is that we have told you all the things that could potentially happen here. These are the things that we're going to give you every single time you come here. These are our expectations with regard to what exactly is going on. But good questions to ask is this going to interact with any of my current medicines? Is there anything that I need to stop? And I would make sure that you've got your list of everything that you're taking. Again, if you are putting it in or on your body, make sure that it's on there, because a lot of times you'll have individuals that will have all their prescriptions. And then when you start asking, well, any eye drops? Oh yeah, I take Zalatan for my glaucoma. Okay, well that's not on your list. Oh, I take a nitro every now and then for chest pain. Okay, well that's not on your list. There's a lot of things that people don't think about. So I would make sure that you have that list and that it's up to date with everything that you're taking. And so if you get constipated on Sundays, if you can expect that, every Sunday I wake up and I'm constipated for whatever reason, if you take something consistently, or, you're taking something maybe once a week, make sure that that's on that list too. Something that we call PRN, so as needed. So if you have got any as needed medicines, make sure they're on there as well. So I would make sure that you are asking those questions. But everything else that you are going to need to know about that medicine is going to be in all that paperwork. They're going to tell you every possible side effect that they want you to monitor for while you're on it.
We only have time for 2 more questions. We're going to take one on that side and one here, and then Dr. Blasek will be here for a little bit afterwards. She can answer a few questions. Yeah. Go ahead.
Okay, doctor's great presentation.
Thank
very,
you.
very informative.
Thank you.
Nan is in her 3rd year post-diagnosis. And thus far, the meds, and she's been on several, on 3 right now, but they haven't seemed to have done a whole lot for her. Is it wise at this point to just stop all meds and see if things are okay? Because we know, meds are going to be there down the line for sure. But we've heard that some PD patients have done that, take no meds, and see if that helps.
I would work with your physician about that, but there have been individuals that I've worked with who have stopped everything and never cold turkey, because you don't want to incite what's called neuroleptic malignant syndrome, which can be very, very dangerous and can put her in the hospital. So you always want to work with your doctor about that stuff. But if you feel like, these medicines are just not working, if you are not satisfied with what you were experiencing with those medicines, it may be time for a retrial. Figure out what exactly is going on. And, while I don't always recommend just getting rid of everything, but I would almost, I'd almost recommend that you work with the physician and do one thing at a time and see, okay, if I don't need this new pro patch, if I take off the new pro patch, I taper off the new pro patch in a week, was that medicine making any difference? But doing one thing at a time for sure. Yeah. Okay.
Thank you for a very thorough presentation.
Sure.
My question is in regard to, I saw an announcement on the Michael J. Fox Foundation. Help me. What is it? On the computer, and it said that the FDA had approved amantadine extended release for people with dyskinesias and possibly wearing off. Do you have any information about that?
So amantadine, and you're asking about the extended release amantadine. Amantadine is a medicine that a lot of times physicians are going to use when people start to have dyskinesias. So when they are feeling, the medicine is working, they are on, they're feeling good. Those are those rhythmic motions, kind of dance-like movements that people experience. If you ever watch Michael J. Fox, he is always dyskinetic. I don't know if I've ever seen him not dyskinetic unless he's on ice skates and he's playing hockey. But amantadine can be effective for dyskinesias, can be. It's one of those medicines where I worry about the individuals that I've known that have been on that have sometimes experienced really bad hallucinations. I've had individuals who have said, I have had really vivid dreams, very real feeling, scary dreams. It's also a medicine that we need to be very cautious in people who have any decrease in their kidney function. So it's something that we have to dose adjust. I can't honestly, amantadine, when I think of amantadine, it's normally a drug that we'll either give once or twice a day. And in those cases, I always wonder, is this something that we need an extended release version of? When you can just give it once a day and people are going to be okay. So sometimes that approval, sometimes that medicine, getting an ER formulation is basically an attempt at patent extension and to make a little money. So in my mind, an amantadine ER product would be something I would be very cautiously optimistic about, simply because of the side effects I've had, individuals I've worked with experience with that medicine, and then the renal or the kidney issues that we can sometimes see. It's not causing kidney issues. It's just a medicine we have to be very cautious with in those individuals with any element of kidney dysfunction or kidney problems. Yeah.
Okay, we have a couple announcements to make, and I have a pop quiz. What would be the reason that someone might be able, they might be dyskinetic, but they might be able to play hockey just fine? They're using intent, right? Let's all give Dr. Blasek a round of applause.
Thank you. Thank you.